Hey everybody, Mike Russell here with Optimal Physical Therapy. How's it going? I'm here in California, San Diego area for a business conference, and I'm having a great time. What's funny about this little time away that I have here is I started thinking about runners and run-related injuries. And the reason I thought of this topic was when I went out on a run this morning, I didn't have my typical running shoes. I had a different pair of shoes. And I thought to myself, I hope I don't get an injury by wearing these shoes and running. And so I thought, how many other people are thinking that? Think that, well, I have a pain while I run. It must be related to my shoes. And they run out and buy a pair of shoes that are in excess of $120. And then it not get better. Now, I have also had people in the clinic as recent as last week who have had pain for 12, 13, even 15 months. And finally, the pain or the injury that they've sustained has prevented them from running. They are unable to run. Now, think about that. If you're out there running and you have to stop because of some kind of stabbing, irritating, noxious pain, there's a problem. That's just not that routine ache or soreness that we get when we run, especially if we're doing longer distances or if we're challenging ourselves on hills or on certain types of trails that we run on. I think runners have misconceptions. Having thought of these misconceptions, I threw them all down on a blog, and I'm going to attach it to this post to let you and give you an idea of what I'm coming from when I'm trying to rehabilitate you guys. Because it's not always a foam roller problem that can resolve it. It's not an ice issue that can just ice it down and be done with it. It's not even rest. If you took 2 weeks of rest off, it's still going to be there when you get out and start building your miles back up again. So I want you to be on the trails. I want you to be running on the roads. I want to increase the amount of time you spend out there running because I know how much fun you have with it. So 4 misconceptions of run-related injuries, what to do about them, and then or some what not to do, and then what to do as part of it all there. So I think you'll really enjoy it. Can't wait to get back into the clinic next week and see how everybody's doing and get you guys running on the trails again. Have a great night.